Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for parents and caregivers of children age 18 months. Tip number 1 is read and talk to your child. 18-month-olds are at a period of intense language development, and you can encourage your child's language development by reading to them every day, singing to them, and talking to them about what you are both doing and seeing together. Tip number 2, praise your child. Praise your child for doing well. This is just as important as telling your child when he or she, it's actually more important than telling your child when he or she is doing something that is wrong. So praising your child and setting a good example are essential for their development. Tip number 3, take brief timeouts. When your child is doing something that is inappropriate, such as being aggressive, hitting, or biting, then use brief periods of timeout to teach your child how to behave properly. Tip number 4, when it comes to new foods, try again. 18-month-olds are in a period of learning independence, and in a lot of ways they'll use food as a way of testing their independence. It's important, however, not to limit your child's foods to only what he or she likes. You may have to offer your child the same food several times before she accepts it. Don't give up after 1 or 2 tries. It's important for your child to have a broad range of foods that he or she will eat. Tip number 5. Don't smoke around your child, and don't smoke period, but if you do smoke, don't smoke around your child. And when you are around your child, make sure that you've cleaned your clothes before you are near your child. Secondhand smoke leads to increased risks of respiratory infections and asthma. So it's very important for you to avoid smoking in front of your child or coming into contact with your child if you have smoke on your clothes. Tip number 6 is make sure that whenever your child is in a car, she's in the rear seat and in an approved car seat with the car seat facing backwards. Tip number 7, here are some tips for home safety. Make sure that on all windows above the first floor there are window guards. Make sure that there are smoke detectors on every floor of your house. Make sure that any medicines or cleaning products or poisons are locked away from your child. And try to avoid having a gun in the house. If you must have a gun in the house, then make sure the gun is unloaded, locked, and the ammunition is kept separate from the gun. Tip number 8, dental health. Make sure that your child sees a dentist twice a year, that your child flosses once daily, and brushes their teeth twice daily with a toothpaste that contains fluoride. You will have to help your child with brushing and flossing. Tip number 9, see your doctor. 2 very important things at this visit at 18 months are to make sure all of your vaccinations are up to date, and to make sure that your doctor provides or conducts a screening for autism. The American Academy of Pediatrics recommends screening for autism at 18 months and 24 months. The autism screen, a common autism screen is called the MCHAT, which is 23 questions that your doctor will ask you. There are no specific vaccines to get at 18 months, but it's a good time to make sure that your child is up to date with all of her vaccines. The vaccines that your child should be up to date with are DTaP number 4, Hib number 4, Hep A number 1, MMR number 1, varicella zoster virus number 1, pneumococcal virus number 1, pneumococcal virus number 4, Hep B number 3, and IPV number 3. And tip number 10, believe in yourself. Having a healthy and well-developing 18-month-old is a great goal to strive for, and you can achieve it. I hope these tips have been helpful to you, and thank you very much for listening. Have a great day.